For my project, I am researching social anxiety disorder, which is also known as social phobia. It is the third most common psychiatric disorder. The definition of social anxiety disorder is the fear of social situations that include interaction with other people being negatively judged and evaluated by other people. It is a pervasive disorder and causes anxiety and fear in almost all areas of a person's life. Physical symptoms could include blushing, fast heartbeat, trembling, sweating, nausea, dizziness, or lightheadedness, or muscle tension. People who have social anxiety disorder might avoid situations like interaction with strangers, parties, or social gatherings, going to work or school, starting conversations, making eye contact, dating, and eating in front of others. These symptoms can flare up if you're facing a lot of stress or demands. Causes of social anxiety disorder likely arise from a complex interaction of biological and environmental factors. Possible causes include inherited traits, brain structures, and environment. Anxiety disorders may tend to run in families, but it is unsure how much of it is genetic or due to learned behavior. The amygdala may play a role in controlling fear response. People who have an overactive amygdala may have a heightened fear response, causing increased anxiety in some situations. This disorder can also be learned behavior. Some develop it after an unpleasant or embarrassing social situation. People under 35, people with chronic diseases, and women, who are twice as likely to be affected by men, are all at a higher risk of developing social anxiety disorders. Someone with an anxious personality or a type C personality, who are people who are detail-oriented or perfectionists, are more likely to have a social anxiety also. Early recognition and detection of impairments during childhood, coupled with engagement in evidence-based treatment and early in life, may offset the trajectory of social anxiety to persist into adulthood. Doing pleasurable or relaxing activities such as hobbies when you're feeling anxious could help reduce anxious feelings. Avoiding the use of drugs or alcohol can also stop this from getting any worse. Common physical symptoms include blushing, trembling, sweating, upset stomach, fast heartbeat, trouble catching your breath, lightheadedness, feeling that your mind went blank, and muscle tension or spasms. People with social anxiety would actively avoid social situations and have trouble making eye contact. If someone is experiencing a lot of these symptoms, they are probably dealing with the disorder. With social anxiety disorder, there may be a dysregulation of neurotransmitters, notably serotonin, but this is not specific to social anxiety, just anxiety in general. There are 4 areas of the brain that are involved in our anxiety response system: the brainstem, which controls cardiovascular and respiratory functions, the limbic system, which controls mood and anxiety, the prefrontal cortex, which makes appraisals of risk and danger, and the motor cortex, which controls the muscles. These parts are supplied with 3 major neurotransmitters, which all play a role in the regulation of arousal and anxiety. An estimated 7.1 of U.S. adults, which is around 15 million, have had social anxiety disorder in the past year, and past year prevalence of social anxiety disorder among adults were higher for females, which was 8%, than males, which was 6.1%. An estimated 12.1% of U.S. adults experience social anxiety disorder at some time in their lives. Of adults with social anxiety disorder in the past year, an estimated 29.9% had serious impairments, and 38.8% had moderate impairments, and 31.1% had mild impairments. Social anxiety typically begins around age 13. Individuals with social phobia usually live with their disorder for years or even decades before they seek help. It is rarely diagnosed by professionals. More men than women seek help for social phobias, though women have been recorded to have the illness. Though more women are estimated to have the disorder. Common myths pertaining to this disorder are that people with social anxiety don't like to talk. It may seem this way, but people who experience social anxiety find it difficult to talk because they lack the social skills necessary to maintain a proper conversation. Another myth would be that people with social anxiety are antisocial. Looking up antisocial, it means contrary to laws and customs of society, in a way that causes annoyance and disapproval with others. People with social anxiety don't seek to hurt people, they just have a hard time making social connections. Another myth would be that social anxiety is not that common. About 15 million American adults have social anxiety disorder, which means 1 in every 16 U.S. adults deals with this. It might seem as though it is not as common because the condition doesn't manifest a huge storm and usually goes undiagnosed. Psychotherapy, also known as psychological counseling or talk therapy, improves systems in most people with social anxiety disorder. You can learn how to recognize and change negative thoughts about yourself and develop skills to help you gain confidence in social situations. Pertaining to social anxiety disorder, SSRIs, selective serotonin reuptake inhibitors, are often the first type of drug tried for persistent symptoms of social anxiety. Examples of medicine that might be prescribed are Paxil or Zoloft. A few famous people that have been diagnosed with social anxiety disorder were Abraham Lincoln, Vincent van Gogh, and Paula Deen.